my last video, I was just talking about the dangers of living in TJ. Well, right now, just as soon as I 2 minutes, not even 2 minutes after I stopped that video, a guy in a motorcycle got hit by a truck. Luckily, we were going at really low speeds, so he did fall off, and he did look like he was in some pain. He was moving his shoulder, moving his knee, and he had a little bit of a limp. We weren't going more than 10 miles an hour, more than 5 miles an hour, something like that. Yeah, you're on a motorcycle. This goes for any country, really, anywhere you ride. You're putting your life in danger. And which brings me to the second point. In Mexico, health insurance is a lot different. There's a lot of private health care, meaning you can pay out of pocket. I have some relatives who work in the U.S. but have a Mexican health insurance because they live over here. They do that thing I saw in my last video where they live in Mexico to take advantage of the low cost of living and earn over in the U.S. It's kind of hard when you need to drive over if you're in the regular traffic. There's 3 levels of traffic. Well, this video is about insurance. Okay. So instead of getting health insurance in the U.S., they have it here in Mexico through their work. That's the only way to get that health insurance. I forget what it's called. It's called like SIMSAS something. You can pay out of pocket, but it's a little higher, and it all depends on how many people in your family. It could be anywhere. It's typically be less than what you get in California. Is it less than other states? I don't know. So in California, you have a family of 4. You're looking at I mean, the minimum is probably like $200 each. Imagine $800 a month just in healthcare. Or let's say that's the lower end. You can go up to like $1,500 depending on what you get. So here in Mexico, we've shopped around a little bit. And here we can get, it's a little bit more affordable. I think for a family of 4, I think it was roughly like $500 a month, something like that. But here's the issue: the medical care in Mexico, well, there's good and bad, just like anywhere else. In Mexico, they're good for they're good for like the little things, smaller stuff. There was one time I got sick, and my girlfriend at the time, my wife now, took me to a pharmacy, and at the pharmacy they had a free clinic. So there was a doctor, on-call doctor, not on-call, a in-person doctor. You just wait in line. There is a menu board or a cost board of what services they offer at cost. So the visit's free, but if you want treatment, then it's going to cost you. And it's attached to the pharmacy, which I thought was a fantastic way of having healthcare. So you walk in, you tell him what's going on. He goes, all right, I got to check this, and this. And if, we'll go from there. I ended up having some sort of throat infection, bacterial or virus. It was a bacterial something in my throat, so did my wife. Anyway, so he checked us both out. He prescribed antibiotics, and it was like $8. And because the visit was free, I felt weird not giving him some money. I think people tip him, so I think I ended up tipping him like, I don't know, it was like, I asked my wife, it was like $10. Is that too little or too? She goes, no, that's fine. They get paid by the pharmacy. They even get paid by prescription. So I mean that might be some conflict of interest, but it didn't matter. I ended up walking out of there paying less than $20 for an exam by an actual doctor. He actually graduated medical school in Mexico, and antibiotics in less than 15 minutes. Unheard of. If I were to have done that through Kaiser in California, the urgent care, depending on your plan, I would have paid $30 for my urgent care. I would have waited, who knows, an hour and change, depending on how busy it was. I would take another 20 minutes from the pharmacy, and then that would cost probably another $20. And that's like a good price range. People who don't have that kind of insurance, who knows what they'd pay? They'd probably have to pay $2,000 just for a sore throat. Of course, I wouldn't. If I didn't have a healthcare plan, there's no way I would have gone through all that. Maybe there's something in California, one of those little urgent care places, it'd be cheaper. Maybe you can get away with 200 or 300 bucks. Anyway, so it's under $20 in and out, no issue. Other things too, maybe some preventative care. You can go into just about any place here and pay out of pocket, and they can go over whatever you need. My wife was going through, she did some body sonograms, and out of pocket she was less than 100 bucks. It was cool. There's just a bunch of different places you can go. They're actual doctors. You get whatever sonogram, you get whatever test. You can have an MRI. You don't need to go through your general practitioner. You could just go straight to a specialist, and all very affordable. So all that stuff, easy, no problem here in Mexico. But where it gets tricky is when it's something bigger. Let's say maybe a broken bone here might be okay. I've never had that issue here. But something like, let's say, I don't know, cancer or a really big accident, you don't really want to be here for that. The way they practice medicine here is a different standard than the U.S. Okay, I'm trying to be somewhat politically correct. In the U.S., higher standards. Okay, so if you do have something big, you definitely want to go over there. So a good idea, what some people do, is they'll have just the basics, a basic plan in the U.S. Try not to use it, right? Use it as little as possible and get everything out of pocket here. So that way, well, it mitigate the costs. But if you have, let's say you are working in the U.S., so a lot of jobs offer medical, so it might just work out better for you that way. But you're still going to want to do some stuff over here in Mexico. It's a lot easier, and again, it's not even a headache at all. Anyway, nice chatting with you guys.